Indications and complications of blood transfusion. Red blood cell transfusions. Red blood cell transfusions are given to raise the hematocrit levels in patients with a severe anemia or to replace losses during the acute bleeding episodes. Preparations containing red blood cells are mainly of three types. First one, whole blood, packed red blood cells, autologous packed red blood cells. Coming to the first one, whole blood. Whole blood contains all components of blood such as red blood cells, plasma, and platelets. Whole blood transfusion is used during surgery and acute blood loss. Coming to the second one, packed red blood cells. Packed red blood cells do not contain any other components of blood. Each unit has a volume of about 300 ml, of which approximately 200 ml consist of red blood cells. Packed RBC transfusion is useful in patients with severe anemia who already have normal plasma volume. Coming to the third one, autologous packed red blood cells. Patients scheduled for elective surgery may donate their own blood beforehand for transfusion during surgery. These units may be stored for up to 35 days. Coming to the compatibility testing. Before transfusion, the recipient's and donor's blood are cross-matched to avoid hemolytic transfusion reactions. Although many antigen systems are present on red blood cells, only the ABO and RH systems are specifically tested prior to all transfusions. Incompatible blood transfusion can lead to severe blood transfusion reactions. Now, coming to the complications of blood transfusion. Transfusion reactions such as hemolytic and non-hemolytic can occur. Transmission of infections such as hepatitis B, HIV, hepatitis C, and malaria and syphilis can occur. Circulatory overload can occur. Hypocalcemia due to the citrate binding to calcium in stored blood can occur. Next complication is hyperkalemia due to potassium coming out of RBCs in stored blood. Next one is hypothermia due to the massive blood transfusion of fridge stored blood. Next one is thrombocytopenia seen in massive blood transfusion because platelets do not survive for long in stored blood. Next complication is iron overload seen in thalassemia due to recurrent blood transfusion.